You know what I don't get about reproduction and biology is that how come Hugh Hefner could crank out a kid at 80 something? And yet women seem to be penalized and can't reproduce beyond menopause, which is like, what, 50, 60 years old? And it just seems like there are so many more stupid men in the world than women. That biologically, why isn't that reversed?
Well, maybe it's because we're too tired to have a baby that old. It's a lot of work, you know. I'm with my little great nephew for a few hours now, and I'm like, you know what? This is a lot. This is really a lot. You know what? Maybe nature was right to say we shouldn't have babies over a certain age.
Maybe you're right. I mean,
it's very tiring.
Women do most of the work at home and at work, and maybe that's why, just to get a little bit of a break.
Yeah, maybe it was the right thing to say, no more, no more.
Welcome to Fat Science. I'm Mark Wright, along with Andrea Taylor and Dr. Emily Cooper, two of my favorite people. How you doing?
Good. How are you?
Hello.
All right, on the show this week, this is going to be really interesting to talk about. Is male menopause real? Is it a thing? We've talked about perimenopause before on the show, and menopause and hormonally big changes that can have a big impact on health in our lives. But this is a really interesting topic, Dr. Cooper, that I don't think we talk about enough. But man, if you look at TV and the internet, there are all kinds of companies trying to get you to buy things that will boost your testosterone, because I guess it's kind of important, right? I mean, it was when I first came to see you many years ago. That's one of the first things that you addressed.
Yeah, it's, testosterone for many years has been thought of as like a magic hormone for men that improves their stamina, improves their sexual function, improves their energy, their mood. And so it's been attractive for a long time to men. But more recently, there's some good research about testosterone and some of the things, dispelling a lot of the myths around testosterone that we've heard in the past. But men don't really have, unlike women, they don't have a time when their testosterone just drops. Like for women, our hormones definitely go through like major decline around the time of menopause. So for men, we hear that term andropause, and there's a lot of controversy of whether that really is a real thing, because with men it's more that there is a little bit of a decline, a gradual slow decline with aging, but it's not like a sudden time that it suddenly drops out, contrary to how women's bodies are.
So men can reproduce pretty much until the end of their lives, right?
Yeah, the sperm quality might not be as good, but that varies from man to man. So, their ability to reproduce is still there. And some men we see in our clinic that are older have great high levels of testosterone that are similar to men in their 20s or 30s. And then same thing, some men in their 20s or 30s have testosterone levels that are typically thought of as levels you would see in males that are 70 and higher. Okay. So it's very individual.
So right out of the chute, we have dispelled the myth that there is a thing called male menopause, that our fertility can slow down as our age increases. But what I'd love to know is that, when it comes to treating metabolic issues, sometimes testosterone can get whacked out to the point where I had to inject testosterone in my thigh for several years when I first started coming to see you. And I still don't fully understand why that is, but now I don't have to anymore because my body has taken over that function. Let's go back in time. And when you first noticed that in me, what was the problem?
Well, the problem there was, what's interesting is there's different reasons for low testosterone, and those could range from problems that are primarily centered around the testicles themselves. The testicles are what produce testosterone. And so you can have testicular malfunctions, like due to an injury, potentially. Some males that have had a major injury to their testicles at any time in their life can have problems with testosterone production long term. And so that would be one situation. But the ones that we see more commonly when it comes to metabolic dysfunction is really what's called hypothalamic hypogonadism. So in women, this causes amenorrhea, where they don't have their period, or oligomenorrhea, where their periods are far apart, and causes infertility in women. But in men, this hypothalamic hypogonadism causes the signals from the brain that normally tell the testicles to make the testosterone, causes those to become weak. And so then the testicles are not receiving any instructions to produce testosterone, and so their output ends up kind of low.
Wow, that's interesting. So they actually rely on the brain to tell how much and when to make testosterone. Wow,
Yes,
that's fascinating.
And it's based on feedback. So then the level of testosterone that's produced circulates back to the brain. Then the brain alters its signal back to the testicles to say, well, that was enough or that's not enough. But the problem with the hypothalamic is the brain has decided, no, you're not authorized to make the testosterone. We want it to be low. And what's the advantage of that? The crazy thing is with metabolism problems, remember we talk about this, that there's an agenda in the physiology to slow your metabolism, conserve energy, increase your appetite, everything that it can do to put you in a state of where you can keep gaining body fat and be tired and keep having a high appetite and things like that, because there's a perception of famine in the system based on chemical status. And so when you have that condition, one of the things the brain does to conserve energy is says, okay, then you're not allowed to make testosterone, because in males, testosterone increases your energy level. It makes you build muscle, which takes a lot of energy. And then it also makes men less worried about risks. And so they're more likely to go out and do adventurous things that also cost more energy. So it's more convenient to just
Like skydiving and
Yes, exactly.
skateboarding on a huge ramp.
Yeah. And if
I
you're
get
really
that.
young, it's like, I always warn young men about this.
But that's interesting, though. The brain is always thinking about safety, security. How do we not risk ourselves, right?
Yes. Yeah. How do we turn the dial down and conserve energy? So then the poor person this is happening to feels more tired.
Oh, yeah.
Doesn't really feel like exercising, and then starts to develop like a situation where they might lose muscle mass because they can't maintain it because the testosterone's going down so much. But then to compound the problem, there's another thing that happens when a lot of men, not every man, but like I think the majority I see with metabolic syndrome, this happens, that when the little bit of testosterone you are producing, it ends up in the belly fat converting to estrogen. And when that happens, the estrogen feeds back and further suppresses those brain signals.
Oh,
So
which
then
explains
you're-
why I was on anastrozole. Is that right?
Right. Yes, that's the name of it. Yeah, to block that reaction. It's an aromatase inhibitor. And a lot of people know about that medicine because it's used also in breast cancer treatment for women, because it's used to block estrogen production. But in men, it blocks the total testosterone levels coming from the testicles from converting into estrogen in the belly fat. And so that way the testosterone builds up a little better and also converts more to what's called free testosterone, which is more bioactive. But so if you don't block that estrogen production, it's a vicious cycle where the testosterone stays really low. That would happen even if you had someone take testosterone. That testosterone that they're taking as a medicine would convert to estrogen too much and still block the cycle. So then you'll have men that have too much estrogen and not enough testosterone. And that causes in men like distribution of body fat around the hips, the belly, the breasts, female distribution.
Mm-hmm.
So
this is why the 50-year-old men have the tummies.
and they call it man boobs.
Yes.
I actually did have some buildup of, I don't know what it was, fat around the nipple area, But it's so typical, isn't it, as men age? And that's because of estrogen levels, huh?
It can be. I mean, there could be other reasons, but it can happen even in adolescent males, that have metabolic dysfunction. And it's, people can become very self-conscious about it. So it always should be evaluated. If a young male, presents with that, they should definitely have their testosterone and estrogen levels measured, but also it's good to do like breast cancer screening in males too, if there's anything unusual, because males can get breast cancer. And so it's good to do breast cancer screening if you think that there's like enlargement of the breasts or something. But for the most part, that metabolic dysfunction in men, it definitely messes with the testosterone pathway in most men that are affected by metabolic dysfunction.
So wait, what's the difference between free testosterone and total testosterone, like regular testosterone? Are they two different things? Is one just bigger or one cheaper? What's the difference?
Well, if you think about the testosterone pathway, remember there's the hormones from the brain. Those are luteinizing hormone and follicle stimulating. Same ones that in women trigger ovulation and estrogen production. But in men, they send that signal to the testicles. The testicles respond. If the hormone levels are prompting the testicles that, hey, we need more testosterone, then the testicles produce more testosterone in response to those hormones. And the testosterone the testicles produce is in the form of total testosterone. And that's the same as if males are taking testosterone as a medicine, it's total testosterone they take. Then in the body is able to convert the total to a different form called free. And so the way it does is it kind of rations the amount that's bound to proteins in the blood and frees up some of it so that has more action basically in the body. And that's good for, like, almost all hormones have that. It's so that our body can kind of shift the levels up or down based on demand, based on what we need at the moment. But the total is more of a substantial, longer form. And so what's interesting is that when you have metabolic problems with males with metabolic problems, alterations in these famine signals and the security signals that we've talked about, they affect not only the brain signals, but the ability of the total testosterone to convert to the free form. And so if you have someone who has low leptin levels, which is that beneficial hormone from the body fat, and they have high ghrelin levels, which is that hunger signal, then they'll have more trouble not only signaling the testicles to make the testosterone, but getting the total to convert to the free. It just gets hung up in there. And so that's why it's so important to look at the whole picture, because if, say, someone was doing a workup and they just went to, just look at what's my testosterone, and someone, and nobody's really looking at their metabolism, and they just look and they see just their total testosterone is low, then maybe put them on testosterone therapy, you're still going to have problems converting that to the free. And as we described before, if there's a metabolic problem, a lot of it might get converted to estrogen, and then you end up building up your estrogen so much. So wow. This is something that was funny because it actually happens to athletes that do the doping because they don't realize that sometimes if they really take a lot of testosterone, it starts boosting up their estrogen so much. And that's not beneficial.
Right, because I see a lot of billboards for guys who are pumping iron and being muscle guys. There's all these big testosterone supplements or something that I see billboards for. Take more testosterone, be more macho, take this, whatever. I don't know what they are because I have no, understanding of any of that. But I know that they want to be testosterone heavy. So that would be very funny. I mean, that's the irony of it.
It is.
Yeah.
It's funny.
I'll tell you, though, when I first started injecting testosterone, Dr. Cooper said that it might change how I feel.
Did you feel good?
I felt actually very calm and sort of more self-assured. And stronger, definitely, in terms of like wanting, like right now, I've been telling myself, Dr. Cooper, for like a year, just get down on the ground and start doing push-ups. And then I'll think about it for a minute. I'll go, no, I don't think maybe I'll do that tomorrow. But when things are balanced out right, you actually want to stress those muscles and you want to build that strength. And it was actually very, very beneficial. I guess the question I have, Dr. Cooper, as we age and as our testosterone levels begin to fall, what's an appropriate level? Like if we have some labs done, and when should we consider maybe testosterone supplements of some kind? Because there's not just injectables, but aren't there gels and things like that too?
Yes, yeah. For the testosterone replacement, there's definitely different forms. So there's the gels, the creams, there's patches, there's injections like the big needle. There's actually a small pen, which is really great, which is kind of like the Ozempic pen,
Yeah.
or the Mounjaro pen, and so there's all kinds of forms of it. And we don't usually use pills because the pills give so many variable levels. It's too complicated to use it as an oral medication. But the thing about it is you wouldn't want to just start on testosterone therapy without knowing that bigger picture, because it could be that you have enough that your testosterone is just getting converted to estrogen too much, and maybe just blocking that pathway would restore normal testosterone production. So that's always a good place to start if that's the case, if the estrogen is high. But there are levels, and the levels of normal ranges do change with age. And then, of course, insurance companies require it to be a certain level before they'll approve the fancier types of testosterone therapy. So you'd want to, once you have it measured, look at the age-related scale based on the lab that's being measured. But in general, below 300 would be considered low for the total testosterone at any age, pretty much.
So there was a new study done about concerns about taking testosterone and levels and things. What should we know? What's the info?
Well, there's been a lot of controversy over the years. I mean, one of the things that's been a myth is that testosterone makes men enraged and
Angry.
all of that, agitated. And as Mark said, you actually felt calmer when you took it, Mark. And so what experts that study like testosterone receptors in the brain have said is that testosterone's actions in the brain in a male is more to calm them and to reduce anxiety and to reduce the level of like worry, basically. And so that's like a myth, about that. It actually does help mood normally if the testosterone levels are in a good range. But aside from that, there was also some controversy long ago in like 2014, 15, 16 or so. Some observations came out saying, oh, maybe testosterone increases cardiovascular risk. So that was suddenly a concern, and everybody was saying, get off testosterone, it can cause heart attacks. And then other studies came out saying, no, there's an increase these studies were poorly done, and it was that people taking testosterone that had underlying undiagnosed cardiovascular disease may have had more events because they felt more energized and went out and did more exercise and things like that, but weren't conditioned to do it. So that might have brought on some more cardiovascular events in that process. Then later, the FDA stepped in and said, well, look, we need to have a formal study of whether or not testosterone causes any increased risk of cardiovascular disease or major adverse cardiovascular outcomes. And at the same time, they looked to see because another controversy area was about prostate cancer and prostate hypertrophy, whether it aggravated that. So at the same time, they studied all of those things. And just last year, I think they wrapped up the data. It was a long-term study with over 5,000 people, I think, although I'm not sure how many completed the study. But in general, it was like the biggest study that ever happened to look at these factors. And the end result was that it's very safe, that it actually did not increase cardiovascular risk at all, or prostate cancer risk, or prostate hypertrophy risk. And in fact, the people that had naturally low testosterone had greater risk for those conditions. So, so I think that settled it pretty much. That it does not, and it also showed some cardiometabolic benefit as well. And so we see in our patients, even though this may not have been studied, just our own observations in our clinic patients, that the testosterone is beneficial metabolically for our male patients. If they had a low level and it improves, it does go along with an improvement in their metabolic picture. So, of course, if you are doing any kind of testosterone replacement, you never want to go above normal ranges with the therapeutic options, because that could introduce risks that are associated with above normal testosterone intake, and that would be elevated blood pressure and elevated red blood cell counts. And so the goal of any therapy would be to monitor it closely and to stay within the therapeutic range that's normal for that patient.
Wow, that's really interesting. I have to ask Dr. Cooper, I see these supplement ads all the time saying that if you take this supplement, it's going to boost your T, boost your testosterone. We've talked about supplements in other areas, and it's important to note that from a legal standpoint, supplement companies don't have to prove that anything works. They don't even have to prove that they're safe, I don't think.
No, they don't.
So, what's your best advice when it comes to, guys especially are, and now that social media algorithms know how we're going to vote in the next election, for Pete's sake, and they know that I'm struggling with my golf swing, by the way, and I'm getting tons of golf instructional videos.
I think testosterone will help you with a golf swing, Mark. It will improve.
Maybe hit the ball further.
It will make you ready for the PGA Classic.
I love it. But what's your best advice when it comes to, can we believe any supplement claim when it comes to boosting testosterone levels?
No, not really. Especially, I think. Sorry to bring her back. I know. Well, especially testosterone. It's kind of the same as weight loss. It's one of those that's been the most, abused, I guess, of all supplements, and the most dangerous too. So anything marketed for weight loss, testosterone, they have found more emergency room visits, more side effects and problems. And so a lot of it's because they have to put something in it to make you feel like it's working. And who knows what they're putting in there, whether it's some kind of stimulant or, the problem is there's still a fair amount of these supplements that are adulterated with sometimes pharmaceutical drugs. So if you're getting any kind of supplements, doesn't matter what it is, you choose GMP certified, good manufacturing practices, certified supplements, and third-party tested to make sure it is what they say it is in the first place. But it's unlikely that any kind of supplement is going to improve your testosterone. Because as we said, look at how complicated it is. The patients we see, it's low. Either they had an injury, which isn't going to improve from a supplement, or they've got this hypothalamic hypogonadism, which is more metabolic and it's very complex. So there's not a supplement that will cure that.
Isn't it interesting, though, Dr. Cooper, that testosterone and estrogen, the typically male and female hormones, are present in both females and males? And I find that just completely fascinating, that as we evolved as a species, that there's a value and a use and a benefit for the correct balance of these two. I wonder, why is that?
Yeah, it is so interesting that our biology determines that balance, and that, just as we said, the male brain is full of these receptors for testosterone. The women's brain's not full of those. So it wouldn't do us any good. It wouldn't make us less anxious if we took a lot of testosterone. So our bodies are just designed differently. It's very interesting, and it's interesting. I've been learning a lot about other species that are kind of more fluid with what happens in their bodies. But it's fascinating. And there is the biologic clock, for women is so kind of much more definitive, and in men that just gradual decline of testosterone, and the estrogens, usually if you don't have metabolic dysfunction, it usually just stays stable in men. It's so different.
Okay, sometimes I've heard of women being prescribed testosterone. What's that all about?
Yeah. Well, we talked a lot about andropause or male testosterone. And then on the women's side, we kind of mentioned that it's different. And so when you think about it with women, there's a perimenopause period. And so women that are entering the normal would be over 45, that their hormones start to differ, start to change. And this period can be anywhere from 6 months to 3 years of roller coaster of hormones where the estrogen levels are normal, and then all of a sudden they're bottoming out, then they're normal, and then they're bottoming out. And so it does create a lot of symptoms for women. Some of the main symptoms are hot flashes, feeling like it's really hot. They're actually called flushes. Or difficulty sleeping, joint pain, irritability.
Cranky.
So there's a lot of symptoms that can go on. And some women have no symptoms, like hardly any. And then others have a really rough time. But in women, women's testosterone is primarily produced by the adrenal gland and somewhat by the ovaries. So the percentages differ woman to woman of how much is produced in the adrenal versus the ovaries. But so during the period of perimenopause and menopause, the ovarian testosterone production does decrease a little. It does decrease. It doesn't go all the way away like estrogen does, but it decreases a little. And so if you have women whose baseline testosterone levels were kind of on the low side, then as they go through perimenopause, menopause, they could drop down more. And the studies show that women do tend to feel better when their testosterone is not too low. So there are women that are prescribed testosterone to boost it up a little into the female normal ranges, basically. But you have to keep in mind that the female normal range is like so low compared to the male normal range. So say a female total testosterone range might go up to 45. We're talking about the males that are under 300 are kind of on the low side. So there's a huge difference, right? And so the whole hormone replacement therapy world is like full of conflicting information. I think everyone agrees that women that are going through menopause on the early side, like for sure, if you're like 40 or something, 40 to 45, absolutely need to take hormone therapy. Maybe not testosterone, but estrogen and progesterone. And that's for bone health. And that's because that's very premature to go through menopause. 45 to 50, probably also good idea, to do hormone replacement therapy. Over 50, now you're getting into the normal age for menopause. And so then it becomes a very individual decision based on your symptoms. But there is a movement now where women are being prescribed testosterone a lot more than they ever were before. And in some cases, really high doses. So not just getting them into the female normal range, but I'm seeing, the pellets, the testosterone pellets put in for women that are bringing their levels up close to that bottom of the range for males. And this is not really studied for safety. I know people will argue because there's a whole bunch of cheerleaders for this, but there aren't any high quality studies showing that that is safe long term to do that. And where it stemmed from was there were some observational studies that kind of just happened to see that breast cancer rates in women were lower when they were on high dose testosterone, especially if it were combined with another medicine that blocked their estrogen. And so that's not how it's being prescribed right now. And that's not been proven. That was like sort of an observational where they're looking into it more. But how it's being prescribed right now is with estrogen. So that's totally different than what was observed in these. So my advice to my own patients is to if you're doing the testosterone replacement, keep it in just the female normal range.
Wow, this has been a really interesting discussion. So male menopause is not scientifically a thing, but
Things happen.
things happen.
Yes.
There's a gradual decline as we age. Dr. Cooper, what's your best advice as we wrap up? If there's a guy listening who just doesn't feel the energy that he used to feel and just kind of feels blah all the time, what's a correct course of action or a helpful course of action instead of clicking on the Instagram post for some weird supplement?
Yes. Yeah. I mean, that is an area where they do have a lot of these like man clinics and things online. And some of them do a better job of measuring things. And at least they identify if the estrogen's high and, the testosterone ranges. But some of them will really dose high levels that are not appropriate and can lead to health concerns, and they don't monitor enough. So I am a big advocate of primary care providers. I mean, I just think your primary care provider is the one you should talk to because they know your whole entire health. They have access to all your labs. They can order whatever labs, and just maybe have a conversation with them and say, have I been checked for metabolic syndrome? I feel like maybe I'm having symptoms of low testosterone, which would be like feeling tired, foggy. A lot of men think that testosterone improves erectile dysfunction, but that is one thing they found with that study. It doesn't. Like that's really was a surprise to me. But they found it improves male sexual experience and sexual function in general and libido, but it did not improve erectile dysfunction.
Which is more of a circulatory issue. Right?
Exactly. But that's something that should be looked into because it could be a sign of underlying vascular concerns or cardiovascular. So anyway, all these are kind of hard discussions to have probably, but it's really great if you have a relationship with your primary care doc to bring all these things up with them and see if you're a candidate for testosterone therapy and maybe ask about the estrogen. Is my estrogen too high? Is that a concern? And do I have metabolic syndrome? Is this coming because of prediabetes or something going on metabolically? Is it part of a bigger picture?
Great stuff. Andrea, anything from you before we sign off?
Always get the bigger picture. Always look for the bigger picture because it's never just one thing. I mean, that's the whole deal with medicine, I think. It's never just one little thing, even though wouldn't it be nice if it was? Wouldn't it be nice if it was just like a hangnail? I mean, really. But it never is.
As we've talked in the past, it could be sleep apnea that's causing you to feel tired all the time.
Oh, my God.
So, I mean, there are so many things.
We forgot about that thing, that terrible thing.
Well, this has been a great discussion. Thanks, you two, for another edition of Fat Science.
No diets, no agendas, just science that makes you feel better.